we're here to talk about the privacy standards. And what is protected? We're going to sort of build up a definition here. We're going to talk about the information that is covered by the privacy rule under HIPAA. So we start with health information. And health information is any information that is created or received by a provider, a plan, public health authority, an employer, an insurer, a school, university, a clearinghouse. This is in any medium, any format, oral, written, electronic, that relates to the past, present, or future physical, mental health condition, or the provision of health care services, any treatment of any individual received, or any past, present, or future payments for such care. So that's the health information definition. HIPAA covers individually identifiable health information. And this is health information that either identifies an individual on its face or contains enough information that it's reasonably believable that you will know who that person is. We'll see in a little bit, there's 18 characteristics which helps identify an individual. HIPAA focuses on the protected health information. This is individually identifiable health information that's transmitted or maintained in electronic or other form or medium. Now, this does not include information that is contained in educational records. There's some interplay between HIPAA and FERPA, which is the Family Education Rights and Privacy Act. If it's and FERPA is a different set of regulations. It's governed by the Department of Education, not Department of Health and Human Services. The violations are different. The uses of educational records are very different than the uses of medical records under HIPAA. The violations, as I understand, are a lot less stringent, but you need to be aware of the differences. Educational records, if it's something that directly relates to a student. Another piece of FERPA is a treatment record, which is a medical record made specifically for that student, and the only person that sees it is their healthcare provider. Educational records and treatment records are not covered under HIPAA. They are governed under FERPA. So it's an important distinction. But HIPAA covers PHI. For our purposes here, this is the protected health information of the plan beneficiaries. Anything on one end of the spectrum, you have protected health information. You can have information that has been de-identified, and this is, in other words, unprotected. We mentioned the individual identifiable. These are the identifiers. There are 18 of them. If it contains someone's health information and their name, their address, the date that they received the medical service, their date of birth, you can see telephone, fax numbers. If the information that is being used or disclosed does not contain any of these information, and you'll notice the final bullet point is any other unique identifying number. If it doesn't contain, if it's been scrubbed of all of these identifiers, then it can be used for any use or purpose. But if not, then it's protected. It's protected health information, and we'll talk about the proper uses and disclosures. About once a year, we probably get a call about a nurse in a hospital. We represent a lot of healthcare providers. We have a lot of cases of nurses posting things on Facebook. Look at this, and they post a picture of their patient, or post a picture of some interesting case. And this is where it gets into problems, because within that picture on Facebook, there's enough identifiers. If you can tell who that person is, you've got a HIPAA violation. So those are the identifiers. So we talked about what information is covered. Let's talk about who it affects. The privacy rule affects 3 different groups. We call them covered entities. And I'll start from the bottom one first. Healthcare providers are the hospitals, the physicians, the dentists, anyone that furnishes healthcare services. And not only that, anyone who transmits any information in connection with the provision of services. In other words, they have to bill for it, they have to submit claims electronically. Another reason why sometimes you have colleges and universities have health clinics on sites, not only are the student health records not covered under HIPAA, they're covered under FERPA, but the health clinics usually don't bill. They'll see the students, they'll treat them, they'll release them. They'll keep the records, again, protected under FERPA, but under HIPAA, because the provider is not submitting claims electronically, they are not a covered entity. The second category is clearinghouses. These are billing companies. These are companies that take unformatted information and format it, not applicable. The first bullet point here are health plans, and these are individual and group plans, provider pay for. This is health, dental, vision. This includes HMOs. This includes Medicare and Medicaid, payers. A couple exceptions, if it's a self-funded plan with less than 50 participants, or if they only cover workers' comp or auto insurance. But brings us to Johnson & Wales. This is why we're here. Johnson & Wales has a employer-sponsored group health plan, including dental. This falls under the covered entity definition of the privacy rule. An interesting nuance, it's actually the plan is the covered entity. You as employees at the university are operating on the plan's behalf, also part of the covered entity. So, to recap so far, we've covered what information is covered, the protected health information of the beneficiaries. We've talked about who it pertains to, its covered entities, its plans, providers, healthcare clearinghouses. The privacy rule itself regulates the use and disclosure of the PHI, of the protected health information, by the covered entities. And it creates standards for the individuals. They have privacy rights on how the information is used and disclosed, how each of you can use and disclose their information. We'll get to that shortly.